Didn't think measles was still a thing? Think again, because right now, the American Southwest is facing a health crisis that many thought was a thing of the past. For decades, measles was considered nearly eradicated in the United States, thanks to widespread vaccination campaigns and public health efforts. But in 2024, the story has changed dramatically. There's a massive outbreak in Utah and Arizona, and it's spreading fast. Health officials are sounding the alarm as new cases are reported almost daily. And the numbers are climbing at a rate that has stunned even seasoned epidemiologists. The outbreak isn't just a blip on the radar, it's a wake-up call for communities across the country. So, what's really going on? Since August, more than 100 people in Utah and Arizona have been diagnosed with measles, a number that hasn't been seen in these states for years. Hospitals are on high alert, and local clinics are scrambling to keep up with the influx of patients. The Centers for Disease Control and Prevention has dispatched teams to help contain the outbreak, and state health departments are working around the clock to track cases and notify those who may have been exposed. The worst outbreak in these states in years didn't just appear out of nowhere. It all started with a few travelers who didn't know they were contagious, unknowingly carrying the virus with them as they moved through airports, bus stations, and crowded public spaces. These initial cases quickly multiplied, as measles is one of the most contagious viruses known to science. Now, communities like Colorado City are seeing cases skyrocket, especially in areas where vaccination rates are low. In these rural towns, access to healthcare can be limited, and misinformation about vaccines has taken root. As a result, entire neighborhoods are at risk, and local clinics are overwhelmed with concerned families seeking answers and care. Here's why this matters. Measles isn't just another virus. It's not a mild childhood illness that you can simply brush off. Measles can cause severe complications, including pneumonia, brain swelling, and even death, especially in young children and people with weakened immune systems. The virus can linger in the air for up to 2 hours after an infected person has left the room, making it incredibly easy to catch. One person with measles can infect up to 18 others. That's a higher transmission rate than almost any other known virus. Imagine a single infected child attending a birthday party or going to school. Within days, dozens of others could be at risk. The virus spreads through coughing, sneezing, or even just breathing the same air as someone who's infected. It hangs in the air for hours, waiting to catch the next person who walks by. That means you don't even have to be in direct contact with someone who's sick. Just being in the same room, hours later, could be enough to get infected. This is why measles outbreaks can spiral out of control so quickly, especially in places where people gather indoors, like schools, clinics, and community centers. And it's hitting kids the hardest, especially those who aren't vaccinated. Pediatricians are seeing a surge in young patients with high fevers, rashes, and severe respiratory symptoms. For some, the illness is mild, but for others, it can mean days in the hospital, struggling to breathe or fighting off secondary infections. Parents are terrified, and doctors are urging families to take the threat seriously. Experts say declining vaccination rates are to blame. Over the past decade, vaccine hesitancy has grown, fueled by misinformation on social media and a false sense of security that measles was no longer a threat. But as more parents choose to skip or delay the MMR vaccine, the community's protection, known as herd immunity, breaks down, leaving everyone more vulnerable. In some schools, less than 10% of kids have the measles shot. That's an astonishingly low number, and it means that if just one infected person walks through those doors, the virus can spread like wildfire. School nurses are on the front lines, checking immunization records and sending home letters to parents, but the risk remains high. That's far below the 95% needed to keep outbreaks from happening. Public health experts agree. To stop measles in its tracks, at least 95% of the population needs to be vaccinated. This level of coverage creates a protective barrier, making it nearly impossible for the virus to find new hosts. But when vaccination rates drop, that barrier crumbles and outbreaks become inevitable. The good news? The MMR vaccine is 97% effective. That means almost everyone who gets both recommended doses is protected for life. The vaccine is safe, thoroughly tested, and has prevented millions of cases and thousands of deaths worldwide. It's one of the greatest achievements in modern medicine. Health departments are launching free vaccine clinics, sending out exposure alerts, and working with schools and community leaders to get the word out. Mobile clinics are traveling to rural areas, making it easier for families to get vaccinated without having to travel long distances. Community health events are offering free shots, And local leaders are encouraging everyone to check their immunization records, and even quarantining those exposed. In some cases, entire classrooms or workplaces have been asked to stay home for weeks to prevent further spread. Public health officials are holding press conferences, urging calm but stressing the importance of immediate action. They're reminding everyone that measles is not just a personal risk, it's a community threat. Bottom line: measles spreads like wildfire, but it's totally preventable. The power to stop this outbreak is in our hands. By getting vaccinated, checking our records, and encouraging friends and family to do the same, we can protect not just ourselves but our entire community. So check your vaccine status, stay alert for symptoms, and help stop the spread before it hits your community. The choices we make today will determine whether measles remains a threat or becomes a thing of the past once again.